How many times a day should you actually pee? The day after I had my kidney stone surgery, I suddenly couldn't pee. My bladder felt completely full, but nothing was coming out. I'm a urologist. This is literally what I do for a living. I know what happens after surgery, and I still panicked. I stood there waiting for what felt like 5 hours, but in reality, it was about 5 minutes. So when I started to finally flow again and start emptying my bladder and peeing, I realized at that moment in time, the problem wasn't even my bladder. It was actually constipation. From all the bladder spasm medicines and pain meds that I had taken right after surgery, I got constipated and now I also couldn't pee. So if it's happened to me, it may also happen to you. Hey, what's up everybody? I'm Dr. Jamin Brombaugh, or Dr. B as most of my patients call me. I'm a urologist and robotic surgeon in Orlando, Florida, and I've spent my entire career helping patients with exactly this kind of stuff, while also at the same time sharing health education through TED Talks and international media. So today I want to walk you through the full picture of healthy urination. How many times a day is actually normal, what it means if you're going too much or if you're going too little, and what to do if, like me, you suddenly can't go to the bathroom. So let's get started. Wait, before we get started, I think I have to go pee first. So what's a normal amount of times to go pee in a day? For most healthy people, it's 6 to 8 times a day. Spread that across the hours you're awake, and it works out to about every 2 to 3 hours. Going more than the usual, we call that frequency. Now, there is some wiggle room in here. Some people pee up to 10 or more times a day, especially if they're drinking a lot of water or other fluids that make you go more, like alcohol, tea, or coffee. These liquids also may have a diuretic effect and can irritate the bladder. If going so much is affecting you or annoying you, there's a simple fix. Just cut back a little. Less coffee, less tea, less peeing. I know it sounds easier than it really is, but the answer to your problems can really be that simple. Now, what about at night? Ideally, you're sleeping straight through. But if you're regularly waking up multiple times throughout the night, you may be dealing with what we call nocturia. I've actually made a full video on nocturia that explains the causes, the symptoms that you should watch out for, and what you can do about it. So please make sure to check it out. When it comes to frequency and nocturia, everyone's a little different. There's no single magic number that applies to every person, and that number can change based on several factors. If it's hot outside and you're sweating a lot, you may naturally pee less. If you're at happy hour and had one too many cocktails, you may naturally pee more. The real key is knowing what's normal for you. If you suddenly notice you're running to the bathroom way more or way less than what's typical for you and it's affecting your quality of life, this is not something you should ignore. It's worth taking the time to get checked out. Let's talk about peeing too frequently, when it's not just from drinking a ton of water. Some reasons you may pee too much: overactive bladder, diabetes, a urinary tract infection, medications like diuretics prescribed for blood pressure or heart conditions. Peeing is also controlled by a complex neurological system that is full of signals constantly firing between your bladder, your urethra, and your brain. So excessive urination can sometimes trace back to something neurologic like a stroke, a spinal cord injury, Parkinson's disease, or multiple sclerosis. Pregnancy is another factor, simply because your body is processing a lot more fluid. And stress or anxiety can genuinely make you pee more too. That fight or flight response can actually cause your bladder to contract and increase urine production. For women specifically, hormonal changes around menopause can also play a role in the function of your bladder. Declining estrogen levels can affect the bladder directly because there are actually estrogen receptors in bladder tissue, which is why some women find relief with vaginal estrogen treatments for overactive bladder. If your peeing pattern is bothering you or you're regularly getting up at night, that's worth bringing up with your primary care doctor or someone like me, a urologist. We can help figure out what's actually going on and start getting you back on track. Sometimes we'll even bring in a physical therapist or pelvic floor therapist if it looks like it has something to do with pelvic floor dysfunction. And There's also the option to start medications that can slow down your bladder, or there's even minimally invasive procedures like Botox injections. Yes, Botox, the same stuff that people inject in their face to look younger, we can actually inject in your bladder to slow it down. And finally, there's nerve stimulation therapies, or what I like to refer to them as pacemakers for the bladder. Now let's take a look back at the other side. Like, what if you're barely peeing, going only every 6 to 8 hours or less than 4 times a day? That could simply mean you're dehydrated, or it could point to an actual issue with how your kidneys are making urine and how your bladder is storing it. On the hydration side, the general guideline is about 90 ounces of fluid a day for women and 125 ounces for men, and that includes water-rich foods, not just what you drink. Not peeing enough isn't just always uncomfortable, but it actually raises your risk of urinary tract infections, since regularly emptying your bladder is one of your body's main defenses against bacteria building up inside of it. And if you're not going enough because you're holding it in on purpose, that habit itself can increase problems like kidney infections, bladder infections, or a weakened bladder muscle from constant straining. And finally, low urine output could also be a sign of kidney issues. If your kidneys are not working right, you will make less urine. And the same goes for your bladder. If it's lost its ability to squeeze, you may retain urine where you're not emptying your bladder, which then means you're going to go less frequently. If your hydration habits are already solid but you're still not peeing enough, that's when it's time to see your doctor. So now let's get back to what happened to me at the start of this video, because there's a level beyond not peeing enough, and that's not being able to pee at all. This is what we call urinary retention, and it's most common in men over the age of 50, usually because of an enlarged prostate blocking the flow of urine from the bladder. After age 70, about 1 in 10 men develop this within 5 years. And by the time they're in their 80s, that jumps to nearly 1 in 3 men. It's far less common in women, but it can still happen from things like nerve issues or a dropped bladder. But like in my case, it's not always about age or your prostate or nerve issues or how much you're drinking or not drinking. Constipation is a huge everyday trigger. Being backed up with stool can literally change the angle of your bladder neck and kink the outlet, which then could translate into not being able to pee. Medications are another big one. Anticholinergics, decongestants, antihistamines, antidepressants, and even pain pills can slow your stream down or completely stop it. That cold medicine that you grab before a flight, it can absolutely do this as well. Here's the key distinction. A weak or stop and start stream is bothersome, but usually not an emergency. But if you genuinely can't pee at all, your bladder feels painfully full, and your belly looks swollen, that's an emergency. You gotta go to the emergency room. You may need a catheter to relieve the pressure from your bladder and to protect your kidneys. The main takeaway here is don't ignore constipation, review your medications with your doctor, and pay attention to a weakening stream before it turns into a full stop. Addressing these small changes early can actually save you a trip to the emergency room. So how do doctors figure out what's actually wrong with your urination? One of the first things we're trying to figure out is this a pipe problem or is this a pump problem? The pipe problem is what we refer to as obstructed. Something is physically in the way and urine can't get out. That could be a stone stuck in your urinary tract, it could be a scar tissue in your urethra, or what we call a stricture. In most men, most of the time, it's actually the prostate. It sits right around the urethra, it grows as you age, and it squeezes that tube from the outside in. When we actually look inside the urethra and inside of the bladder with a camera, or what we refer to as a cystoscopy, we can actually see the prostate blocking the channel. A pump problem is what can be referred to as non-obstructive. Here, the pipe or the urethra is actually fairly open. Nothing is blocking that exit. The bladder muscle just doesn't push the way it's used to. That can come from years of your bladder working overtime against the blockage until it finally wears out or gives up. It can come from diabetes damaging the nerves. It can come from the same neurologic conditions that we discussed earlier, like stroke or Parkinson's or multiple sclerosis. And here's why the difference matters. You fix a blockage very differently than how you would fix a weak muscle. Open the pipe, and if the pump still works, everything flows again. But if the pump is the problem, opening the pipe doesn't really do much for you. Sometimes when we're not really sure if it's a pump or a pipe problem, your doctor may recommend something called urodynamic testing. That's actually nerve testing where we can actually evaluate how well is that pump working and how well is that channel functioning. Treatment options for a slow or no longer pumping bladder do exist. There are things like self-catheterization, intermittent catheterization, long-term catheterizations, or a treatment called sacral neuromodulation, which is essentially a bladder pacemaker. This bladder pacemaker can genuinely be life-changing for the right patient. So if this is something you're dealing with, don't sit on it and don't settle for you're going to have to live with this forever. Don't accept this as permanent until you've had a full evaluation. At the end of the day, the number itself isn't the point. What matters is for you is to know what your normal is. 6 to 8 times a day, about every 2 to 3 hours while you're awake, with 0 to no trips at night. That's the general target. But if your own pattern suddenly shifts in either direction or stops altogether, don't brush it off. Go and get yourself checked out. Worst case, I tell you you're normal. There's no harm in knowing that. There's no downside to knowing. But if you do have a problem, there's many ways that we can try to correct it. Thank you so much for watching. If you got something out of this video, hit that subscribe button, hit the bell so you don't miss the next one, and drop a comment below. Have you ever experienced any of these symptoms? Would love to hear from you. And if you want to know more about what your urine says about your health, check out my full video explaining every urine color and what it means for you. This is Dr. B. Thank you so much for watching, and I'll see you in the next video.